1, 2, 3, start.
Hi, hello. My dear friends, I am Dr.Hari Krishna and I am specialized in neurology and chiropractic methods. Today I am going to talk about the non-surgical decompression therapy. It's the latest invention. As physiotherapy is advancing, it was replaced by traction. Olden days we used to use traction, static and intermittent modes. Now the technology has changed and the evolutionary changes we have emerged with the latest invention with non-surgical decompression, where we can avoid so many surgeries and which is more benefited to the patients. Most of the population, more than 50 to 60% of the patients were suffering with back pain. So out of 15 to 60% of population and 30% of people are going for surgical managements. Now we introduced non-surgical decompression therapy, which is mostly useful for the patient in avoiding the surgery in day-to-day life. So let us see what is decompression therapy. So similar like traction, previous days we used to have static traction. That means we are using continuous mode, giving weight to the lumbar spine. Now after mechanical traction we started using intermittent traction, traction with few seconds of traction and few seconds of rest. So now non-surgical decompression includes a cyclic method and cyclic and intermittent method and static method with memory programs. So coming to the static traction, we give low weight with duration of more duration. So less weight with more duration is static mode, and the cyclic mode includes a simple amount of weight. With more weight we can gradually increase in 5 steps or 3 steps. It is called cyclic mode. And cyclic intermittent, the weight is gradually increased according to our desire, around 5 steps in 5 cycles in 2 minutes. Second, we can increase up to the whatever desired load we can, and holding time we can, in previous tractions it was 0, but right now when we apply 20 cases of traction, we can reduce it to not for the 0, we can make static traction around 10 kgs of weight. While we are giving 20 kgs, the relaxation will come for 10 kgs and holding time will be always 10 kgs while giving the cyclic intermittent traction. And memory is nothing but the patient who visits today, we apply a dose and we store his memory, and next day it will be easier for a patient to go with the same method.
Ready?
This is the sandals where we use for cervical. In olden days we used to have a collar-like belt for the neck. Now this is a sandal which is attached to the decompression machine, and these two are holding the occipital condyles with a firm manner, so that it gives very good proprioception for the occipital condyles and good relaxation. This belt helps us to stabilize the forehead, and these sandals are to be connected to the machine. And the angulations and for the cervical can be adjusted up and down with the adjustable knobs, which are automatically can be adjusted or through manually. The height of the bed also can be adjusted through the remote up and down as the patient requires. And the angulation should be around 20 degrees for the cervical, and during cervical we raise the bed for giving the angulations and reduce the height of the bed. So this is for the cervical. The same programs are to be continued for even for cervical and lumbar. Also, as similarly I told you, the static, intermittent, progressive intermittent and progressive static and cyclic intermittent. So this wheel helps us to adjust the sacral angle, which is for each patient has their own sacral angle. So the lumbar lordosis varies with the patient to patient. So during the lumbar traction, this adjustment can be made according to the patient. And we also have arm rest, which is adjustable according to the design needs, and also we have the head up also, which is adjusted according to the patients. Even in this decompression machine, we can give different varieties of tractions in supine lying as well as in prone lying and side lying, and in side lying also, and also we can give this intermittent traction for the degenerative joints like osteoarthritis and the elbow, and for the ankle, and for the also wrist joints. But widely popularly used this non-surgical decompression for the lumbar and for the cervical disc problems, as this helps in increasing the disc place as well as also it is providing very good relaxation for the paraspinal muscles, so that the paraspinal muscles, when they get relaxed, they tend to heal, because there will be a lot of improvement in the blood supply, and this blood supply followed, but then it aids in the faster recovering of the tissues. And along with this, and our spinal extension exercises and the tailor-made exercises which are designed for the patients helps a lot. So with this machine, I felt very good recovery when compared to the old machines, and this is very economic when compared to all the brands which are available in the market. So the same quality is maintained in this HMS medical systems, and I found very good results. Here I want to share my ideas with you, as this is very economic in India and readily available for even to get a service done. Even this can be adjusted according to our desire, and the angulation of the pull can be changed with the adjustment where we have this adjustment to change the angle of the machine to straight to sideline with whatever inclination we require the desired position. We can adjust this, and this is very widely popularly used in all the brands which are available. This brand helps us to provide a very good relief to my patients. This machine contains 4 modes. One is static, the other one is intermittent, and progressive static and cyclic intermittent. The static contains the same amount of force what we are giving, the amount of weight we are giving, that holds in a static mode, which is done in the previous machines also. But in intermittent mode, we give 30 kgs and the weight will come to 0 as a previous one. But this machine contains a base weight, which is the amount, suppose we are giving 30 kgs of weight, we can come to 20 and the base weight will be always 10, which holds the weight for the desired time whatever we give, for 1 minute or 5 seconds or 20 seconds. This machine contains 4 modes. One is static, the other one is intermittent, and progressive static and cyclic intermittent. The static contains the same amount of force what we are giving, the amount of weight we are giving, that holds in a static mode, which is done in the previous machines also. But in intermittent mode, we give 30 kgs and the weight will come to 0 as a previous one. But this machine contains a base weight, which is the amount, suppose we are giving 30 kgs of weight, we can come to 20 and the base weight will be always 10, which holds the weight for the desired time whatever we give, for 1 minute or 5 seconds or 20 seconds. As we all know, the clinical practice contains static and intermittent. The static mode holds, if suppose we give 30 kgs, the holding weight will be always 30 in a static mode for a desired time. The intermittent, previously we give 30 kgs or 40 kgs according to the body weight. The weight will come to the maximum of whatever the desire we give, and it comes to 0. And here the cyclic intermittent mode is something interesting here. Suppose we give a weight of 30 kgs and the base weight will be around 6 to 8 kgs. We can adjust according to our desired need and the need of the patient. Suppose we give 30 kgs, the holding time will take in a 5 steps to 30 kgs in around 2 minutes, and gradually this weight will increase. In the olden machines, we give 30 kgs at a time. At a stretch, it will pull 30 kgs at a time. But in this machine, the amount of weight is carried in 2 minutes in a 5 steps. So this is called cyclic intermittent mode. The pulling will be 30 kgs in a 2 minutes, and it will come to base weight around 6 to 8 kgs. The base weight means the pulling force will not come to zero. They always hold to 6 to 8 kgs minimum. Whatever the weight we are going to give for a base weight, it will come to there and it holds, and again the pulling will start. This treatment is very effective when we are giving to 15 to 20 minutes of duration, and in my experience nowadays the treatment has reduced from months to days. So this machine is giving very effective results when it is compared with all the other modalities, and it has become the part of the treatment in lower back pain. Non-surgical decompression machine contains 4 modes. One is static, intermediate, and progressive static and cyclic intermediate. The static, as we know, we give the amount of weight, holding time will be the same, and you don't get any sort of relaxation in between this. The intermediate, it gives 30 kgs and the traction weight will come to 0. Coming to the progressive static mode, suppose we give 30 kgs amount of weight, this weight is gradually pulled in a matter of 2 minutes, and the holding will be the same without any sort of relaxation. This is pre-static mode. Coming to the cyclic intermittent mode, the 30 kgs amount of weight will be gradually increased in 5 steps, and there will be pull of 30 kgs in 2 minutes, and the relaxation period will come for the base weight, which is around 6 to 8 kgs. This can be adjusted according to the patient's need and the condition. So suppose 30 and my base weight will be 8 kgs. The pull will be initially in 2 minutes, it will be around 30 kgs, and followed relaxation, it will come for the 8 kgs, and the holding will be there. Again there will be a progressive increase in the weight for 30, and followed again it will come for 8. This cycle will repeat for 15 to 20 minutes, where it is giving very good results for the patients. Thank you. As I told you, we can give traction in supine, prone, side lying as well as. Now I am going here to demonstrate how to give traction in supine position.
Series.
This belt has to be adjusted by seeing the ASIS. This triangle shaped one should come for the center for the pull, so I am fixing it. I am removing the slack and make this should be kept tight on the ASAS, and this belt should be on the center of the pull. So I am adjusting how to adjust this belt.
So I cut one.
bed should be in the middle, so the angular pull will be more.
Focus work.
The upper bed should be reinforced like this. These are axillary posts which are to be supported in the axilla. This is the position. Then before starting, we should unlock the bed so that it gives very good traction, and also we should adjust the inclination according to the sacral angle so that it will provide you a very good comfort for the patient.
Ideal position சொல்லுங்க சார். Now அந்த இது adjust பண்ண ideal position, patient ideal position. அதுக்கு என்ன சொல்லுவோம்? அது சொல்லிட்டு adjust பண்ணுங்க.
This adjustment is for the pelvic as well as to create an angle for the lumbosacral region. So as this lumbar lordosis is changing for every patient, so this gives a comfort for the lumbosacral area. And before starting, we should see the patient is comfortable or not, and also we should provide a remote switch, safety switch before starting, and ask the patient whether he is comfortable in this position, and then we will start treating him. Now as I am going for lumbar traction, I am adjusting my bed downward so that the angle of pull will change. In my experience, I am giving 25 to 30 degrees of inclination for lumbar region, and this can be adjusted according to patient and desired conditions. Now I am going for cyclic intermittent. So as my experience showing that this is giving very good soothing effect, so I am selecting this. So maximum I selected 30 kgs and minimum base weight around 8 kgs. The resting time will be 5 and the holding means 20 seconds. Formula. Good morning, Madhuri Chapana.
Yes sir, yes sir.
Now this is comfortable position. Now I am going to start the cyclic intermediate wave. Now I selected the pelvis at the lumbar region and going to give you in maximum amount of 30 kgs. Now the base weight of 10 kgs. So I am adjusting it. Then selected. The resting time is 5. The holding time is 20 seconds. Then the speed is 5.
Perfect.
In this way, we are going to give traction.
It's enough sir. Sir, both.
As I told you, we can give supine and prone lying also. Now I will show you how to apply traction in prone lying. In the same way, I made the patient to lie in the prone position and I will fix these supporters. The same way, we should be in the center. So this is the way to give traction in the prone position. In the same way, we should adjust according to desired need. We will arrange everything and then we should remove the lock on the both sides to have a very good traction. And this is for the patients who are unable to lie in the supine, they can be given traction in the prone line. The same way, we will adjust according to our desired needs in a cyclic intermittent manner and then we give traction in this position. Thank you. Now I am going to show you the cervical traction with Sanders method. Height of the bed is adjusted according to the need. This angulation is around 10 to 20 degrees. The angulation of the bed is increased. So I will show you how to apply the cervical traction. These side supporters are for the too tight or too loose. It should be comfortable for the patient. And this band is for the forehead fixation. In this way, the cervical Sanders is fixed to the cervical traction so that it gives a very good traction in this angle. This angulation can be adjusted according to the desire, whether it is for the upper or lower cervical region. Okay, thank you.